views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRX Tuesday on BronxNet, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Kibin and Alleyne. Coming up, New York City opened the nation's first overdose prevention center. Can a prevention site be a safe way to monitor the opioid crisis? Then, a study conducted by researchers at Montefiore and Einstein highlights that children with obesity and diabetes may face higher risk of being hospitalized. Will asthma and socioeconomic status contribute to this? After that, over 38 million Americans are facing food insecurity. What factors contribute to this, and do food deserts contribute to the issue of food insecurity in our borough? And the New York City Department of Small Business Services plans to administer $100 million to the New York City Small Business COVID-19 Resilience Grant Program. How will the initiative decide who gets priority funding? So please stick around. Open BXRX Tuesday starts now. Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Kibin and Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. New York City opened the nation's first overdose prevention center following CDC reports stating more than 90,000 overdose deaths occurred in the U.S. Over 2,000 deaths occurred in New York City alone. Joining me for discussion on the opioid epidemic is policy researcher for the RAND Corporation, Bryce Pardo. Bryce, thank you for joining me.
Thank you. Glad to be here.
So before we jump into it, can you give us a little background about the research you're doing in regards to the opioid crisis?
Sure. So most of the research that we've been doing here at the RAND Corporation has focused on a couple different dimensions of this problem. One, how to respond to it, but also more importantly, what's been happening in recent years regarding the illicit supply of opioids in these markets, largely because of fentanyl encroaching in these illegal markets. We're seeing deaths rise at unprecedented historic rates. So the question then is, okay, what's changing in these markets, and then how to better respond to them. So that's been what we've been doing in the last few years here at RAND.
Now, we know that opioids are drugs, but for those who are not familiar, can you further explain what opioids are?
Sure. So opioids is a large category of substances that are used to treat pain primarily. These include things like oxycodone, or Oxycontin is the prescription brand name. Other opioids out there that are most commonly used in legal markets are heroin, and then now increasingly fentanyl. But fentanyl is a particularly interesting opioid because it's a synthetic opioid. It's not made from poppy, which heroin and oxycodone and many of the other opioids that we've kind of been using for hundreds of years have derived from poppy. Now that this is no longer being made from plants, it's made in a lab very quickly, very cheaply. And then in particular with the fentanyl series of opioids, they're very different. There are many different types of fentanyls, and some are extremely potent, orders of magnitude more potent than heroin. And so that's creating confusion in markets and really elevating the number of deaths we've been seeing in recent years because people aren't aware that they're consuming fentanyl. And so there's a lot of issues having to do with the emergence of fentanyl in the last few years. We've had a longstanding heroin problem in the United States for almost 100 years now. That's not something new to us, but really the fentanyl problem is what's driving these overdose death numbers up.
According to New York City Health, opioids were involved in 85% of overdose deaths in 2020. We've heard about this being a growing problem for years now, as you mentioned. Overdose death rates are higher and growing faster for some groups and places. Why have we been seeing this increase?
So as I said, this is largely has to do with a shift in the supply in recent years towards synthetic opioids like fentanyl, which are orders of magnitude more potent. So just to kind of give you a perspective, the the average amount of what we're seeing in these counterfeit pills, these are made to look like prescription tablets, but they contain no oxycodone or no active ingredient that an individual is looking for. It contains maybe 2 milligrams of fentanyl. 2 milligrams is about the amount of 2 grains of salt. And so when you're dosing in very small quantities like that, there's very little room for error. And so that's what's kind of contributing to the rise in overdose deaths, is that users and dealers don't really know what they're doing. And that problem when dosing there creates a lot of confusion and a lot of harms, because people just aren't aware of these are markets that are not regulated. So that's what's contributing to this problem here. Prior to that, with heroin, you maybe needed 40 milligrams of heroin in order to elicit the same effect that maybe 1.5 to 2 milligrams of fentanyl would. So that's kind of what's largely contributing to rise in harms.
And has access in general become easier, you feel?
For fentanyl, yes, fentanyl has increased in these markets, but these are long-standing heroin and opiate markets. So these are places where people have long been accustomed to seeking diverted pills. And so that's one of the reasons why you have drug trafficking organizations or criminals that are basically pressing fake counterfeit tablets made to look like a diverted prescription medication. Or what they're doing is taking a little bit of fentanyl and mixing that with the heroin and selling that in retail markets. And so people think they're buying these longstanding opiates like heroin or oxycodone, diverted pills. Come to find out, that's not what they're buying. They're buying fentanyl and they're overdosing. So it's not really that the accessibility of opiates has increased. It's more just that the market has shifted towards, I guess, more accessible fentanyl. I mean, that is what's really more accessible now. The numbers of fentanyl in drug seizure data and in overdose death data has really shot up in the last 5-6 years. So that's what's happening. We've had kind of a long-standing, millions of Americans have an opioid use disorder. There's millions more probably in recovery. And so there's a lot of people there. There's a huge huge population of people who have become accustomed to using opiates, or they require it because they're physically dependent on it, chemically dependent on it. But then the market suddenly shifts towards a very powerful, potent alternative, and people aren't aware. And so that's what's kind of contributing to the rise in overdose deaths.
Now, in an effort to combat this, the city of New York opened the nation's first overdose prevention center. Mayor Bill de Blasio says overdose prevention centers are a safe and effective way to address the opioid crisis, but they are supervised consumption sites or facilities. What are your thoughts on that?
So supervised consumption sites, this is, first for the United States. This hasn't been done before here, at least not officially. There have been a couple underground facilities. And I mean, fact of the matter is, a lot of places where people do use drugs, they're somewhat supervised. A lot of people do use informally, they kind of have other people there, other drug users there. In other parts of the world, Canada, Europe, Australia, they've been using supervised consumption facilities where an individual goes into these facilities after buying powdered heroin or some other drug from the street market. They go to these facilities. They then use those drugs there under some sort of supervision, so that in case an overdose does occur, someone is there to administer naloxone. But these facilities do a lot more than just supervising use. They offer sterile injection equipment. They offer kind of basic psychosocial services, referrals to treatment, all other types of harm reduction interventions that are needed to really reverse some of these overdoses. So offering naloxone at cost or free to the individuals. So they do a lot more than just supervising consumption, at least outside of the United States, which we've studied. These are very novel harm reduction interventions, and so far the literature, by and large, has said that there's favorable outcomes here. It doesn't really solve the problem necessarily, but it can help to alleviate some of the risks, or reduce some of the risks associated with overdose in these markets. Will it be a silver bullet? No, it probably won't be, but it will help some individuals kind of have access to other harm reduction services, or may be able to survive another day because their overdose was reversed.
Now, I know some critics have some opinions about this, and they view it as an opportunity to create spaces that accommodate and magnify drug use. Have you found that to be true, or do you agree, or feel like they have a valid reason for thinking that?
So that is generally the concern when opening up these facilities. In other countries where we've seen supervised consumption sites open up, the community, the business community, the religious community in those areas largely is very negative on their opening. But after a period of time, it really doesn't seem to bother them. There are benefits to moving some of that drug use out of public, kind of the common areas that you passersby don't have to kind of step over people nodding out. You don't have to see discarded needles. So there are some benefits to some of these things, as the literature has generally shown that there's people that are able to get some basic services in these facilities. They discard their used needles there instead of discarding them on the street. They're supervised, and then after their use, they're then taken to kind of a cool down area where they're monitored in case they have an allergic reaction, so they're not nodding out in the street. So there are benefits to having these. And then again, after a few years of their opening, generally the business community kind of subsides. The pushback really subsides. There's no evidence to suggest this increases use. And in fact, I mean, you can make the argument that by removing public consumption from the kind of visible spaces, you're really taking that away from people's perception. I mean, you're no longer. I live here in DC, and I walk by a lot of people that are nodding out and kind of passed out on the street. So you're removing that kind of perception of people just kind of that drug use behavior in public spaces.
So since we're talking about location a little bit, there's one in East Harlem that rests across the street from a school. Do you think people in this situation are right to have these concerns regarding the placement of this site just because it's across the street from children?
So generally you would want to cite these things away from activities where children are living and engaging in school, of course. But is there already? I would first ask: is there already public drug use there? And then I would say if there is, then you would really have to weigh the costs of seeing people strung out or passed out or nodding out in view of children instead of where this happens kind of behind closed doors under some sort of medical supervision. Again, the literature shows that there is no increased use and consumption due to the opening of these sites. This isn't like a bar where people can kind of go and this isn't necessarily an attractive place to go. I'm guessing they're citing these near the school because there's already public consumption there, is my guess. If that's the case, again, you would need to weigh what the existing system is, or which is basically letting people use in public versus having them do so in a kind of closed door space away from public view.
All right, that was a really great point. I never actually thought of maybe there's already use there. So I'm really glad that you pointed that out.
I mean, typically that's the case in Canada where they're doing this. They're citing these where drug use is occurring, right? In public spaces like parks in the downtown east side in Vancouver, where there's a lot of drug use already. So it's not like they're just picking a spot. I mean, I don't know about the case in New York, but I would imagine they're doing this where it's already occurring.
All right. Now, how can people connect with you and stay educated on this topic?
Sure thing. You can look up our reports online at Rand Corporation, as well as connect personally to me on Twitter. My username right there. But all of our research is publicly available. We've done a lot on supervised consumption sites and other harm reduction interventions, as well as trying to understand how these markets are transitioning and to better respond to them. So please feel free to check it out.
All right, Bryce, thank you so much for joining me.
Thank you, Kibin.
We'll be right back with more Open BXRX Tuesday. Welcome back. At the start of the pandemic, many believed children faced very mild symptoms of COVID 19. While that belief still remains prevalent, a study conducted by researchers at Montefiore and Einstein highlights that children with obesity and diabetes may actually face higher risks of being hospitalized. Joining me for a discussion on this is study author Dr. Jerry Chao. Doctor, thank you for joining me.
Thank you. Thank you so much. Very happy to be here.
So, as part of the Montefiore and Einstein health system, you led a study looking closely at how COVID affects children with pre existing conditions. Can you tell us more about that?
Yeah. Early on in the pandemic, we studied some of the first children who were getting sick from COVID. As our experience grew, we wanted to study more of the children who were testing positive for COVID and how many of them required hospitalization. We wanted to see if risk factors, such as obesity or a past medical history of asthma, were different in the children who required hospitalization in order to try to figure out which children seemed to get sicker.
Now, one of the factors her team looked at, as you mentioned, is diabetes. According to the CDC, type 1 diabetes is most often diagnosed in children, teens, and young adults, and now more kids are developing type 2 diabetes. Can you tell those who don't know the difference between the two types of diabetes? Can you tell us what the difference is?
Mhm. In type 1 diabetes, the body cannot produce insulin, which is the hormone that helps sugar enter the cells to produce energy. As a result, sugar builds up in the bloodstream and damages the body. It's thought to occur because the body attacks itself by mistake, destroying its own cells in the pancreas. This can be caused by genetic reasons or environmental triggers such as viruses. Diet, or the food we tend to eat, and lifestyle habits don't cause type 1 diabetes. On the other hand, in type 2 diabetes, insulin is still produced by the pancreas. The cells in the body do not respond normally to it. It's called insulin resistance. More and more children are developing type 2 diabetes. This may be due to certain habits related to diet, again, the type of food that people tend to eat, as well as limited physical activity. In order to study this, we analyzed children from March to October in 2020 of the coronavirus pandemic, and we looked at 319 children overall. Of those, 87, or about 27%, were hospitalized. 6 children in the study had a history of diabetes, all of them type 2 diabetes, and all of them were hospitalized. This suggests that a past medical history of diabetes is associated with increased need for hospitalization.
Now, you mentioned another factor was obesity. According to several reports, obesity and diabetes have both increased in children amid the pandemic. Can you explain some reasons why we may have seen such a huge change in a short period of time?
There is thinking that decreased outdoor activity during the pandemic, combined with staying at home, may have contributed to more obesity and diabetes in children. Also, children who are already developing obesity and diabetes, this process, it may have been accelerated because of the pandemic. This underscores the importance of continued health maintenance and prevention now more than ever, especially during the winter holiday season with Christmas and New Year's celebrations approaching. Children and people of all ages should be encouraged to receive their COVID vaccination and boosters if eligible, and use protective measures like masking and social distancing.
Now, besides being hospitalized, how else did children with pre-existing conditions differ from those who didn't have them?
In general, the children who needed hospitalization tended to present with more severe symptoms. So, for example, they had fevers, they had developed shortness of breath, fatigue, as well as nausea and vomiting, just to name some examples.
In this study, you also assessed whether asthma and socioeconomic status affected this. Your research found that it did not, but can you explain why it was important to also look at those characteristics as a factor?
It was important to look at those characteristics because it makes sense why they might play a role, and research in general should explore these and all different types of possibilities because sometimes we find results that are not what we expect.
So I could definitely agree to that. I was very surprised to see that asthma and low socioeconomic status had little to no effect on hospitalization rates. Because just based on what we know, that's usually not the case. Do you know why that may be?
We were also surprised. We think it's because the population in the Bronx that we studied is in general of a similar socioeconomic status. So it was difficult to demonstrate differences between the groups because of this similarity. However, we all have clearly seen that COVID disproportionately affects and harms people who are impoverished and people of color. With regard to asthma, our study reinforces other study findings that have shown that children with asthma are not at increased risk for worse illness due to COVID.
Now, I think this study was really interesting because in the beginning of the pandemic, as I mentioned previously, it was believed that kids were not as affected by the virus. And I think some people thought that children couldn't even get it. Can you tell us why that was commonly believed?
Yeah. In the beginning of the pandemic, we were seeing a surge in mostly adults getting sick. We think this may be due to differences in the biology between adults and kids. But as you said, as more and more adults got sicker, they began to expose children more and more to the coronavirus. And as a result, we saw that children could also develop illness as well.
Now, following the study, findings suggest the importance of targeted and proactive outreach to children with obesity and diabetes. What does that look like for families with children within these categories?
We encourage all eligible children to receive their COVID vaccine. People should also continue to wear masks and socially distance, especially in indoors and tightly packed spaces and areas where the health and vaccination status of the people around your children are unknown. As with every important healthcare decision, families of children with obesity and diabetes should consult with their trusted pediatricians and healthcare providers to tailor decisions based on the specific health and needs of their individual child. This should be an ongoing discussion to help families become more comfortable with their decision making.
Now, I really want to know a little bit. We talked about diabetes earlier. How does diabetes actually affect children different from adults?
Yeah. So type 1 diabetes, it tends to come on earlier in life. And so specifically, as I go back to my responses for that, it used to be called insulin dependent or juvenile diabetes and is usually diagnosed in children, teens, and young adults, but it can develop at any age. Type 2 diabetes most often develops in people over the age of 45, but more and more children, as said, teenagers and young adults are also developing it. The effects are generally the same between younger patients and adults, in which blood sugar levels need to be checked often and medications need to be administered to help with the control of blood sugar. However, children and young adults are still growing and developing both physically and emotionally, so they require special considerations and support. I think what's also important to note is that type 2 diabetes can be improved with lifestyle modifications like changes in diet and exercise. So there's an opportunity there to improve one's health with changes.
Thank you. Now, although vaccines have been out and are now recommended for children 5 and up, many parents are still cautious. Can you explain why it's still safer to maybe go with the vaccine despite these health conditions?
The decision for parents and caretakers to vaccinate their eligible children, it's a deeply personal one that depends on a lot of different things. And since the vaccine is so new, parents may understandably have questions about the vaccine. Overall, the vaccine appears to be very safe based on the clinical trial data. We encourage parents and caretakers to have individualized conversations about their child with their trusted pediatricians and healthcare providers to aid in their decision making.
So, where can people go to learn more information about where to get their children vaccinated in the Bronx?
Please visit covid19.montefiore.org to schedule an appointment at Montefiore to get your children vaccinated. You can also look at vaccinefinder.nyc.gov.
And can you tell us how people can actually stay up to date with you and Montefiore and everyone involved with the study?
Definitely. Please visit us on our website as well as on our social media and Twitter resources that you see there below.
All right, Doctor, thank you so much for joining us.
Thank you so much for having me.
We'll be right back with more Open BXRX Tuesday.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet. We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. For millions around the country, food insecurity remains a daily challenge. Here in the Bronx, families and individuals face the highest rate of food insecurity in America. Joining me for discussion on this is John Weed, Assistant Executive Director of BronxWorks. John, thank you so much for joining me.
Thank you. A pleasure.
So, according to a report from Hunger Free America, the Bronx remained New York City's hungriest borough, with more than 1 in 5 Bronx residents experiencing food insecurity. What factors contribute to the numbers of food insecurity that we're seeing in New York City and even in the Bronx?
Well, that's an interesting question. There are many factors really that relate to food insecurity. I mean, you mentioned, the Bronx being 1 in 5 people being food insecure. That's probably going to go up in time, and it certainly went up during the pandemic. But certainly income, low income, unemployment, and living in an area where there's less access to food. And that's certainly the Bronx, all three of those things. The pandemic only heightened things, but there's a lot of work to do in order to help out here.
Now, I'm really curious to know, do people with either disabilities or veterans or like just communities of people, do you know which ones or which communities face food insecurity at a high rate?
I don't have all the statistics in front of me, but I mean, all of those communities have difficulty. Certainly, there's a lot of undocumented here in the Bronx, and they wouldn't have access to certain benefits that help out with food insecurity, certainly disabilities, people not having an ability to move around freely. And as I said before, the access to food is a real important issue here in the Bronx with really, you've heard the term food desert, and that's squarely the Bronx.
Now, last year, the Bronx saw dozens of food distributions and pantries. In what ways did the pandemic exacerbate the problem Bronx sites were seeing with food insecurity?
Clearly, you saw an uptick in food related issues. So you saw more food pantries, you saw longer lines, and a lot of that had to do with unemployment. So the Bronx had an unemployment rate that went up to 25% during the pandemic. I mean, you cite 1 in 5 persons being food insecure, but 1 in 4 were unemployed. So all of those are contributing factors. Here at BronxWorks, we opened 9 food pantries. We already knew about this problem because we had food pantries operating, but we saw an uptick in hungry citizens here, and we stepped up and opened more pantries to combat that.
Now, as people, we often have ideas of what someone who's struggling looks like, but that can honestly just be anyone. What are different forms of food insecurity, and what may that look like to an individual or a family?
Well, certainly people who have reduced food intake, they skip meals, they ration more, you see more people on pantry lines. All of those are indications that food insecurity is at a high level. People spending too much on rent, people who have lost jobs, all of these contribute to the fact that they can't spend money on food. I go back to this food desert issue. People are paying high prices. They go to corner stores and they buy unhealthy food, or they go to a fast food restaurant because supermarkets are not readily available. So affordable food is a very big factor as well. And we don't see enough of that here in the Bronx.
I'm really glad that you brought up food deserts because that was actually going to be one of my questions, whether or not you believe food deserts contribute to the issue of food insecurity. Because I think people often think that food insecurity means that there's no food, but sometimes there's food that's there. It's just not the healthiest. Can you just elaborate that on that a little bit more?
Absolutely. Here at BronxWorks, we've known this issue for a long time. So some of the things that we've done is operate farm stands to bring fresh food to the local people here. And you're showing a picture of one of our farm stands. We operate too. But food deserts, meaning that there isn't a high quality food available, right? So I mentioned corner stores, what they call bodegas, fast food. Those are readily available, but they don't really sell foods that are beneficial, right? So, or healthy. So you can get canned stuff, you can get a lot of sodas, you can get things that aren't necessarily healthy, and you spend a lot more money buying, shopping that way. If we had very high quality supermarkets here, it would be, alleviate that problem quite a bit.
Now, you did mention some of the efforts that BronxWorks has, put into kind of alleviate this problem. And you talked a little bit about your farm stand. I want to go back to that because I actually did cover it before, and I saw the most beautiful vegetables. Like they were just so fresh and clean, and just like they look so good. So can you tell us more about the farm stands and just like the time that they operate, and how that actually came to be?
Sure. So we operate 2 farm stands currently. They both operate from July to November. One is outside our facility on the Grand Concourse, 1130 Grand Concourse. The other is in Mott Haven, and they operate 1 day a week. We bring in fresh produce and fruits, and we bring in whatever is in season at the particular time. So you'll see different offerings throughout the season. But they're very well priced for people, and not only do we sell produce and fruits, but we also do cooking demos. So we teach people how to cook healthy with the particular produce that we're selling that day. We also have health bucks available. Those are additional benefits for people who have SNAP. And so we give those out. This year it was actually $2 for $2. So you'd spend $2 and get $2 in health bucks, which would increase your purchasing power at one of our farm stands. All the produce comes from upstate, comes from farmers that are close by. So it's very, very nice to have these farm stands. And we've done these farm stands for well over, I'd say, 5 or 6 years. We started this initiative because we recognized that there were food insecurity issues here in the Bronx, and certainly food desert.
And I also love that because sometimes going to a supermarket in the Bronx, sometimes the vegetables aren't as fresh, or they're like, maybe they're affordable, but that's because they're about to expire. So I really love seeing that. And I really appreciate that you guys brought that to the Bronx. I also want to talk about the Carolyn McLaughlin Community Center kitchen. I understand the kitchen produces more than 600 meals every day. Can you tell us more about that effort?
Yes. So that's been an effort that's been around for about 20 years now, a kitchen that cooks mainly for our programs that we have on site and off site. But we have, a head cook, we have 2 assistant cooks, we have a kitchen manager. So it's an effort that's done by, only a few staff, and they cook from scratch. They have a very healthy menu. A lot of it is ethnically diverse, so they'll pick something from an African community, and they'll pick something from, say, the Dominican or Hispanic community, and then we always keep our clientele in the process, right? So we do surveys, we do check-ins about how the meals are going, but we feed children in all of our children programs, our early childhood centers. We also send food off-site to homeless individuals, and so it's an effort that really reaches a wide range of people, and people who urgently need the nutrition from the kitchens. So that 600 number goes up quite a bit in the summer, because we convert some of our programs into full-day summer day camp. So we're talking about breakfast, lunch, and dinner. And now we actually are going to start operating 2 brand new senior centers, one here at the Carolyn McLaughlin Community Center, and another offsite that we'll be delivering meals to. So those will be a daily increase of about 100 to 150 meals per day. So that 600 will go up to 750 or so, and that'll happen very soon.
That's wonderful. Thank you for sharing that. Now, fighting against the issue of food insecurity, many locals around New York City and the Bronx began creating community fridges. What are some other ways people can help someone struggling with food insecurity?
Certainly, those fridges have been vital in the effort, and people can donate to those fridges. There are a few in Mott Haven. I think there's a few in this area as well. There's a list of them somewhere on the website. But those have been very helpful and unique in terms of this growing problem of food insecurity. But people can also donate their time. They can donate resources. All of our food pantries take items or help. So running a food pantry is very time intensive and logistically difficult. So we always need a lot of people to operate a food pantry. We have 9 of them. One of our food pantries at the Carolyn McLaughlin Community Center is a client choice. So that's very time intensive. That means that people come and they get a shopping list, and then they check off things that they want, and then we shop for them. We've had to rearrange things a little bit since the pandemic so that we're not too close in contact. But people come in, they see a reviewer, they check off what they want, and they go shopping. So it's a very nice way for people to be involved in picking their items of their choice. So that's what we've been doing for at least 2 years now at the 1130 Grand Concourse building.
John, thank you so much for joining us. Can you tell people where they can keep up with you?
Certainly. BronxWorks.org, that's our general website. You can find out all information about our agency at that particular website. Or you can go to, look for our farm stands or food pantries on the website, and then you can contact those individual sites. But certainly we're always welcome to take in new volunteers and resources to help our pantries out. Thank you.
We'll be right back with more Open BXRX Tuesday.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311. 0311
Welcome back. The New York City Department of Small Business Services plans to administer $100 million through the New York City Small Business COVID-19 Resilience Grant Program. Selected by the New York City Department of Small Business Services, Lendistry, the largest minority-led deployer of capital and COVID relief funding, will lead this initiative. Joining me for discussion on this is Everett K. Sands, CEO of Lendistry. Everett, thank you so much for joining me.
Hey, Kibin, how are you doing today?
I'm doing well. How are you?
Can't complain.
So can you tell me about the New York City Small Business COVID-19 Relief Resilience Grant?
Yeah, absolutely. So it's a program administered by the city, obviously sponsored by the mayor and legislative bodies within the city, that is to help small businesses in terms of being able to have money to go towards items that they might have need to either be refunded or expenses they might have as a related of COVID. So think about it like in terms of past expenses they might have or future expenses that they might have in terms of reopening or moving forward during this pandemic.
Now, I think this is really cool and says a lot about your organization. Can you just explain why New York City chose your organization, Lendistry, to lead this initiative?
Yeah, sure. So Lendistry has a good amount of experience in terms of deploying capital. This year, we'll probably deploy roughly about $8-9 billion to about 600,000 small businesses. Sometimes that's loans, sometimes that's grants. We have a significant amount of experience in terms of helping counties and cities and states in terms of deploying capital. And I think equally as important, or maybe more important to your users, is we've had and shown the results of being able to deploy to underserved small businesses. So being able to help those who might not normally get an opportunity to receive a grant or receive access to capital. That's in the fabric of everything we do at Lendistry, and it's inside of our mission.
Now, for this grant, there will be 3 rounds to determine who will receive money first. Can you elaborate on that?
Yeah, so New York City, like many of our partners, has what we call a priority funding. And so what they're looking at is those businesses that have been somewhat disadvantaged in terms of their access to capital in the past. And so they're starting with those businesses first, and then they're essentially tranching. And so what that means is they're taking a step up based on income and based on kind of the viability of the business. And so they're trying to help those, again, that have been hardest hit first, haven't had routine access to capital or traditional access to capital first. Then they're moving up to a second group and then to a third group.
Now, the initiative will award grants of $10,000 to eligible small businesses. What are some of the industries that will see these grants and why?
Yeah, so there's definitely a focus in terms of prioritization in some of the arts and cultural businesses. But that being said, if you go through the 3 tranches, all businesses will get an opportunity. The city of New York is naturally trying to do somewhat between reopening and then helping those who, again, have been hardest hit by the pandemic.
And can you explain what are some of the eligibility requirements?
Yeah, absolutely. So there's a requirement in terms of when they spend the money. The bills have to have been since March. Let me make sure I get it right. March 3rd of 2021, and the money can be spent into December of 2024. They also must be in New York City, so they're trying to help the New York City businesses. I think that's kind of obvious. They have to have less than 500 employees. They're trying to help some of the smaller businesses, and so they're using the size of the business as one of the things that they're looking at. Through the individual tranches, they're looking at the revenue sizes of the business. Again, I don't want to make anyone think that they won't be able to get the grant, but there's definitely a focus on some of the smaller revenue size businesses in the beginning. Outside of that, there's some other guidelines. I don't want to get too deep into the specifics because there's some variations of different things that the business owner might want to look at. So I'm going to encourage them to go to covertresilience.nyc. So HTTPS / covertresilience.nyc to get more information.
We often hear about grants being awarded to businesses, but what does the money actually provide relief for? And what are some examples of situations where this money could be helpful?
Absolutely. So I would tend to try to get the business owner to keep it really simple. So think of things that as a business owner you've paid in the past, or that might be ongoing or that you might have in the future. So top of mind comes things like payroll and benefits of your team members, maybe your rent payment or your mortgage payment. You might have utilities or other expenses connected to your business. Also think about reopening and other things that are going to be related as we go into kind of this new normal with COVID.
And I'm happy that you brought up COVID because Lendistry has previously offered relief to businesses owned by women, minorities, and veterans, which I thought was very interesting. How are businesses owned by people in these communities uniquely affected by the pandemic?
Yeah, so Kibin, I mean, these businesses were in a precarious position, at least a financially precarious position, kind of going into COVID. Lendistry and other mission-based lenders have tried to take charge and try to say, how do we sit at the table? How do we help to make sure these businesses are represented when rules are being created for programs such as this COVID program in NYC? And also how we think about the deployment of capital. So we're trying to do things like make mobile-ready apps and online programs that they can have access to capital to. I think this is the beginning of something great as we think about other ways to add scale and we think about other ways to deploy capital to these businesses.
Now, I mentioned that it was women, minorities, and veterans. Why do businesses in these communities often struggle or find it hard to kind of get a grasp on like owning a business in comparison to maybe uh, businesses that are owned by white people or, just people who aren't struggling as much?
Yeah, it's a great question. So, and it's a broad answer, but I'll kind of give you maybe three things. I think the first thing is we don't have a tendency inside of those communities to have a pass down of information. So whether that be a knowledge base or whether that be an actual business, right? Are we transferring that wealth in terms of business ownership? I think those are things that we're trying to work on. At Lendistry, we have a nonprofit called The Center. What we do there is we do one-on-one counseling, we do online education, but equally as important in some of these grant programs as you'll see at covertresilience.nyc, we have application guides in multiple languages. We've got videos to help people in terms of how they apply. But I think it's that transfer of information and that knowledge base is one of the reasons. I think the second thing that we need to look at is who are the deployers of capital. Lendistry is minority-led, as you probably have figured out now looking at me, but how do we bring more minority-led, mission-focused institutions to the table to act as the deployers of capital, to act as those who could help in the systemic structuring of the programs? And that's involved in the rulemaking and how we think about the rules and how we think about people being able to get the access to capital. And then the third thing is I think it has to be the marketing and the outreach, the things that you're doing. So thank you. We've got to change the narrative. We got to let people know that the programs exist, that they're available to them, and then make them feel comfortable in terms of applying, showing them success stories and others that look like them and maybe speak the same language as them, maybe in the same industry that have also received these programs. And hopefully we're doing a good job of that.
Now, what documents should business owners prepare, and how can those who qualify sign up for this grant?
Absolutely. So I'm going to mention covertresilience.nyc as the website to go to. I'm going to encourage the business owner to either take one of the webinars, maybe watch one of the introduction videos, take a look at the FAQs. That's going to help in terms of document preparation. That's also going to help in terms of being ready to apply. This is not, the application is open 24/7. And so they'll have an opportunity to be able to go and to be able to apply at a 24/7. So early in the morning, in the afternoon, and in the evening. In terms of documents, it's going to be some of the basic traditional items. So it's going to be a copy of their photo ID. It's going to be their tax returns. It's going to be able to show proof that they're in business today. We're going to ask for NYS 45 only if it's a larger business greater than 3 million in revenue. We're going to ask for a W-9 form, and we're going to ask for some type of proof that you've actually been affected by COVID. Now, that can be a variety of different things. That could be 2 tax returns where you show, here's what I made in 19 versus 20, or maybe a quarter over quarter. Let me show you Q1 of one quarter during COVID versus Q1 of a past quarter, 2019. So you can see that there was a loss because we're looking to show that loss. Again, in terms of that website, it's going to be covidresilience.nyc.
All right. Now, I want to talk about the importance of accessibility because we noticed on your website, there's actually a dyslexia-friendly option, which is very rare. So can you just tell us why it was important for, your organization to add that?
Yeah, absolutely. I mean, when you think about access to capital, one, there's no silver bullet, right? And we have to recognize that we've got to meet the business owner where they're at. And, part of language is also accessibility, right? It's helping people that might need a better orientation of our website. They might need the words to be bigger. They might need help in terms of the various languages that we offer. And so we're trying to think about these things as we think about one, being culturally conscious, and as well also thinking about how to meet the small business where they're at. A lot of these things have come through feedback of other grant applicants and other loan applicants where they're saying, hey, if you made this tweak or you did this thing, this will make it better for somebody else. So, hats off to the small business owners that are constantly giving us feedback and helping us to improve our systems and our processes and our procedures.
Well, yeah, thank you for explaining that because we thought that was really cool. We never really seen that before. And so I definitely wanted to touch on that. How can people get in touch and learn more?
Absolutely. So I'm going to encourage them to do a couple different things. One, we've got external partners like NYS, SBS, and several other partners. Most of them are mission-based, so you're going to see words like community development financial institutions and other mission-based organizations that are helping. You can find them, again, on that website, covidresilience.nyc. There are going to be webinars in which they're hosting in which to give more information about the program. You could also call into our call center, and that number is 888-959-6471. Again, 888-959-6471. It's a new number, so sorry, I had to take a look at it. But we want to encourage you to either utilize one of our partners, go on the website, download the application guide, go on the website to watch one of the videos, attend one of the webinars that are being offered not only across the city, but also in multiple languages, or you can call our call center, which can also help you.
All right, Everett, thank you so much for joining me for this discussion.
Yeah, thanks for the opportunity.
That's all for our show today. Thanks for tuning in. I'm Kibin, wishing you and yours safety and wellness now and always. See you next time.